watching WKBN 27 First News, where your news comes first. Now in high definition.
Welcome back. Happy Monday. Joining us today is Dr. Mike Sevilla from Salem Community Hospital. We're talking about an issue that's really been brought into the spotlight recently, sudden cardiac death. And just a few weeks ago, we had the student basketball player from Michigan made the winning shot and then died. And that is what doctors are saying is likely the reason. Tell me a little bit about this. How common is that?
It's not very common. Obviously, it's very tragic when you hear a story about it. There was also a rugby player in Colorado and a track star high school student in Florida, all within the same week. So very prominent in the news.
And these young athletes. How does that happen?
Yeah, there's only about approximately 40 cases nationally yearly, and most students don't even have symptoms, but sometimes there could be warning signs of breathing problems, shortness of breath, that type of thing. But I've been getting a lot of questions about, can we prevent this? Could have been prevented.
So what are the current recommendations for sports physicals? Because it seems like to see something like an enlarged heart or something that might cause this, you'd need a CT scan or something a little more in depth than just your regular physical.
Yeah, the testing right now, it's under a lot of debate in the medical community. What the recommendations are right now are an annual history and physical with your physician. What they're looking for is there a family history of heart problems? Does the doctor hear a heart murmur? That type of thing. But other questions have come up. Should all students be tested for heart conditions? And it's a lot of debate. And it's still not really solved right now.
And I know that could be expensive too, just for your child to play sports when they seem perfectly healthy. What are steps for prevention in that case?
Well, what we try to do is when we're trying to recognize the symptoms when a student does collapse. A lot of schools have those AED devices to help restart the heart. There's also been a lot of advocacy to have CPR for teachers, parents, and coaches, so when an incident like this happens on the field, that they take action immediately.
Okay, and I know it's obviously such a tragedy when that happens, so good information for parents and, of course, coaches and students to have as well.
That's right.
Thank you so much for joining us today. We are out of time, but we will be back after this.
You're watching WKBN 27 First News, where your news comes first. Now in high definition.
Well, the parents of student athletes have a lot to be proud of, but also a lot to worry about as well.
Those concerns grow after seeing a couple of promising young athletes die after some health conditions go undetected. Dr. Michael Sevilla joins us this morning to tell us if there's anything parents can do. It really is scary. We've seen two recent cases, really heartfelt cases as well, and you wonder, were there any signs?
Sometimes there can be some signs, and what we're talking about is what's called sudden cardiac death, especially in adolescents. It's different than heart disease that is found in adults, and that's important to know about. What we're finding is that sometimes with these kids is they have an abnormality when they're born, a congenital abnormality. Sometimes it's an abnormal heartbeat. But as far as symptoms go, things that I ask parents are things like passing out, shortness of breath, chest pain. Those are kind of things to look out for.
And this can just occur all of a sudden without even some warnings, is that right? Or are there always warning signs?
There's not always warning signs. That's kind of what's tragic with a lot of these cases is, the first time that somebody may find out that their child has a heart problem is, after an event like this. So sometimes there are not warning signs, so it's very tough.
And this doesn't always occur at birth. It can occur later on in life, is that right?
Yeah, it's not always an abnormality when you're born. Sometimes it's acquired during life. It could be as simple as a viral infection or something of that sort. So it's not something that is really tough to track.
So many kids, and it's been that kind of season too, where there's been a lot of viruses going around. A lot of kids are down. They want to get back out on that court as fast as they can. Even like you've seen some kids play with the flu, so to speak. Should a parent be more worried when they've recently been sick?
Well, what I tell people is if there's a question, see your doctor, because they're the people that can really ask the right questions, do the physical exam. I've been getting a lot of questions of, could this have been prevented? What the recommendations are right now are to go to your doctor and to have your physical exam, a history, especially if there's been a family history of early heart disease, heart death, that type of thing.
So don't just just take the regular physical that you would get at the school. Go to your doctor and make sure that you get an extended physical.
Pretty good workup.
Pretty good checkup.
Well, I mean, a lot of these school-type physicals too, when they have them, they're pretty good as well. But if there's questions, ask the doctor. Get more answers for yourself and for your child.
Yeah, I've heard there are some countries where they actually require like a cardiogram or for student athletes like that. I think somebody said London. I don't know. It was buzzing in the newsroom about something like that. Would that be practical?
Yeah, there's been a couple of studies out now. There's one in Italy and there's one in Israel that have conflicting data as far as is it really going to detect some of these abnormalities. And a cardiogram EKG is only a snapshot in time. It doesn't detect it always. Some people always also talk about an ultrasound. Does that detect it always? Not easy either. So
So if you're having a good day, it might not show. Like you could go through the whole procedure and it's not going to happen.
Yeah, it's a big debate now in the medical field as far as how much testing should we do with these student athletes.
All right, well, coming up, we'll talk more with you in our 6 o'clock hour, especially about what they're recommending, I guess, at some of these sporting events to help treat the athletes as well.
Which you can do.
Moving on now to our family focus segment. 2 teens have died in the last week after collapsing following a game or practice.
But how common is this among athletes, especially in their teens? Dr. Michael Sevilla joins us this morning to tell us if there are signs that just go unnoticed. Good morning, doctor.
Good morning.
Well, tell us, the first one was the basketball player, star athlete, never really showed any kind of signs.
Even during the game. I mean, they showed him right before he put up that beautiful shot to end the game and win, and he didn't look like he was even huffing hard, or...
Yeah, I mean, what we're talking about here is it's called sudden cardiac death in adolescence, and sometimes there aren't any symptoms at all. But when I talk to parents and I talk to athletes, things that I ask them are things like, have they passed out? Have they had chest pain? From my standpoint, do they have like a murmur or an abnormal heartbeat? Those are things that kind of we can look for when we're doing kind of our sports physical exam.
Now, what are some of the things that they're recommending after a couple of these cases? Because this isn't a new thing, but these are 2 cases that have sort of brought this out into the spotlight. What are some of the things that they're recommending now? The
current guidelines right now are saying that every student athlete should have a good history, which includes a family history, including could be a family history of a heart death before the age of 50, those type of things. Also a thorough physical exam too. There's some controversy right now as far as some further testing for these athletes, as far as EKG or an ultrasound. That's big debate now in the medical field.
Any difference on like how conditioned the athlete is either? I mean, because today you have kids of all shapes and sizes playing all kinds of sports, and from very little, 4- and 5-year-olds, and they're running up and down the soccer field, and you see them panting, huffing pretty hard. I mean, is there any indication of how much? It doesn't really matter how in shape your child is.
No, it doesn't, because sometimes we're seeing some of these abnormalities are from birth. Sometimes they're acquired, maybe sometimes through a viral infection. What we're finding more important now is when these events occur, like on a court or in a field, that there are treatments out there now to help save these kids.
And what can do it if something like this does happen on a field or a court? What's the best thing that should be done first, I guess, if there's no paramedic or somebody that's around? Well,
what a lot of people are advocating now are for even teachers and coaches to learn CPR, and for parents to learn CPR. There's a lot of schools around the nation now that have these AEDs, these automatic external defibrillators that can be placed on the chest when the heart stops, and those have been found to save lives.
The faster you get the heart beating again, even in these cases, it will help or could work.
Yeah, there have been documented evidence of this. There's been stories out of saved lives because of using of these AED devices.
Yeah.
All right, Dr. Sevilla, thank you as always. We appreciate the advice and the information.
Thank you.